Welcome back. One of the big health issues today is Lyme disease. It started in Lyme, Connecticut in 1975 and continues to spread north through the capital region. This disease is caused by the bite of a deer tick and is not only dangerous to us, but also to our pets.
Typically, you see the tick appear about a year before you see the disease appear, and that's what happened here. We started to see more and more ticks, and then the following year we started to see the disease, and it has literally exploded. I just think it's one of the most underrated zoonotic diseases that we see. In this practice, 43% of our unvaccinated patients are coming up positive.
This tick-borne disease has a 2-year cycle with 2 high-risk periods.
It's the nymphal stage in the spring, very early, when the leaf masses are just starting to be heated up by the sun, because that's how they overwinter. They will come out, and the nymphal stage will bite and feed on anything. They are really not discriminating at all. Over the course of the summer, when it gets hot and dry, they pretty much disappear, and in the late fall, the nymphal stage turns into the adult, and the adult feeds again.
The adult tick will in turn fall off and dig down under the leaves and lays about 2,000 eggs. The diagnosis of Lyme is so important for both pets and people.
We're using a test made by a company called IDEX, which tests for heartworm, Lyme, and Ehrlichia, all in one combination test.
This should be done every 1 to 2 years to be safe. Waiting for symptoms can sometimes be difficult in pets. Only 5 to 10% of pets infected will develop the illness.
Typically 2 categories. One is arthritis, polyarthritis, where they're painful, they really hurt. These dogs come in and, boy, you just take one look at them and you know that they're really in a lot of pain. They're running a fever. And the other category, which is not as common, is kidney failure. The real tragedy with kidney failure associated with Lyme disease is the nephropathy is almost always fatal. We can't reverse it.
Precautions are the key to both us and our pets.
The very first part of prevention is not allowing your pets or your family to be in areas where you know ticks are. Ticks don't like mowed lawns. They like brush, thicket, overhanging branches, very tall grass, because they don't jump like a flea. They need to turn around and grab onto something as it walks by. So if you can avoid those areas, particularly spring and fall, that's a major benefit.
If your pet tests positive for Lyme, there is a very effective medication.
There is a relatively standard treatment for pets with rickettsial disease, with Lyme disease, and that's doxycycline. It's been around a long time. It's reasonably effective, and there's a standard dose and a standard protocol. Most of the experts are telling us we should treat them for 1 month.
If you find that tick on your pet, what do?
These are readily available. It comes in 2 sizes, and for someone like myself who doesn't have fingernails, it's hard to get down at the base of the tick. Very simple little device. It's got a slot in it, and if you find a tick, you simply put it down against the skin and rock it back, and just gently, that peels the tick out with the mouth parts generally.